Hello, my name is Lea Merrifield, and I am currently in Mr. Tanassi's Sports Med 3 class. For my project, I observe research on eating disorders, and more specifically, their effect on athletes. Types of eating disorders that most affect athletes. Acknowledging what specific eating disorders most affect athletes creates a better idea of how their repercussions ultimately affect their overall athletic status. The two most common eating disorders are anorexia nervosa and bulimia nervosa. Both these conditions consume the individual's head of imperfect body expectations, and from that comes how they deal with it. Anorexia nervosa is an eating disorder in which there's a serious self-starvation, paranoia about gaining weight, even though the individual is very skinny, along with excessive weight loss. Anorexia is more common in females than males, as about one third of males to females are affected. When one has anorexia, they on average are 15% below their normal body mass index. Sad but true, anorexia is the third most common illness amongst teenagers and has a mortality rate of about 5 deaths for every 1,000 people. Then we have bulimia nervosa. Those who suffer from this disorder create a routine of binge eating, typically eating up to 2,000 to 3,000 calories in one sitting, then followed by purging, which is self-induced vomiting. Also, there is an intake of an unnecessary laxative and diet pills, big fear of body perception, as well as presenting weight fluctuations. Along about one-third of male to female suffer from bulimia nervosa, with showing and experiencing symptoms. Though bulimia nervosa may be harder to witness than others, as they usually are normal weight or overweight rather than a sickly skinny. Though both disorders are very detrimental to the individual physically and mentally. For both conditions, only about 1 in 10 receives treatment, and out of those who do receive treatment and or receive help, 35 to 40% relapse to their old habits. How do eating disorders develop? There are multiple ways that one can begin to suffer from an eating disorder. These include genetics, gender, previous or current trauma, sports, age, and societal media exposure. The most common ages to develop and suffer from eating disorders are from the ages of 14 to 25 on average. Gender-wise, women are twice as likely to develop and or report symptoms than men, and that mainly is due to societal standards, hormones, and heavily influenced normality of what a girl's body should look like. As men suffer from the same reasons, the pressure on men is less than women. A study showed that 44% of teenage girls believed they were overweight, and 60% were attempting to lose weight, though they were in the normal BMI range. The repercussion that could come from overly exercising along with not feeding yourself proper nutrients can be detrimental to overall health, thus leading to performance ability. From there, about 62% of female college athletes and 33% of male athletes fell under the category of having an eating disorder. A reason for such a difference between male and females due to the call for a lean, not skinny, but not fat body that women athletics call for in college. Athletics show higher showings of eating disorders as they have a lot of influences around them that have expectations such as the coach and the athlete themselves. Also, comparison between teammates can heavily influence the feeling of being too big. As for men, most athletic sports call for a broader, bigger body in which they have the affluences and influences from comparing themselves. Along with gender-specific callings upon athletes and societal media pressures, genetics play a role in developing eating disorders. It is said that those who have a family member who suffer or have suffered from an eating disorder are 7 to 12 times more likely to develop one themselves. This is due to a mutation of 2 specific chromosomes, 1 in 10. As these mutate after puberty, which is why you see the development in teenagers, they cause a blockage or interfere to specific brain neuroreceptors connected to food relationships. Also, a big factor related to eating disorders are current or previous trauma, whether it be mental, physical, or verbal abuse. These disorders can develop from here as a form of coping, being in control, and or managing emotions. Effects of eating disorders. Next, we get into the symptoms of anorexia and bulimia nervosa. These are the main signs that affect the individual's physical and mental health. For anorexia nervosa, it is common to eat only a few certain low-calorie foods, not wanting to eat in public, lying about how much food has been eaten, having no irregular periods due to the lack of fat needed, excessive exercise, abdominal pain, flat, depressed mood, fatigue, insomnia, fainting, hair breakage, dry or yellowish skin, and frequently skipping meals. For bulimia nervosa, it is typical to have heartburn, indigestion, bloating, swollen glands in your neck and face from inducing vomiting, irregular periods, bloodshot eyes, calluses on hand from purging, weight fluctuations, excessive exercise, sore throat from purging, fainting, dry skin, and frail nails. How common are eating disorders in athletes? Coming from both anorexia and bulimia nervosa, there is a lack of nutrients needed for the body to function in athletes, thus leading to a decrease in muscle mass, then increasing the chance for injuries. And if an individual were to then suffer from an injury, that would remove them from their sport, and time away from sport will eventually lead to a decrease in performance. The diets and pressures from athletics can ultimately create a disconnection from normality through COB4 body type in sports. That normality being a proper diet and proper exercise. It has been studied that among female high school athletes, 41.5% reported disordered eating. High school athletes, more females than males with eating disorders, are 8 times more likely to suffer from an injury. In college, there is more pressure and thus leading to. In Division I NCAA athletes, over 1/3 of female athletes reported attitudes and symptoms placing them at risk for anorexia nervosa. 35% of females and 10% of male college athletes were at risk for anorexia nervosa, while 58% of female and 38% of male college athletes were at risk for bulimia nervosa. In female Division II college athletes, 25% had disordered eating, 26% had menstrual abnormalities, and 10% had low bone mineral density. Now we have diagnosis and treatment. For a diagnosis, if an eating disorder is suspected in yourself or a loved one, a proper diagnosis needs to be made to get proper resources and treatment. The way eating disorders are diagnosed are through signs, symptoms, and eating habits exhibited. If an eating disorder is suspected, your doctor will perform exams and tests to pinpoint and make an accurate diagnosis. Your primary care provider and a mental health professional can make the diagnosis. Especially during the times we're in right now, and if you need an extra hand in knowing how to deal with or talk with someone who may suspect an eating disorder, contact the helpline for support, resources, and treatment options for yourself or a loved one. They will help you find the information and support you are looking for. When it comes to treatment, after a diagnosis is made, a treatment team will help to build a program which should best benefit the patient and their needs and goals. Steps for creating a treatment plan include creating a plan and setting the goals you'll like to see, addressing and treating mental, physical side effects that come from eating disorders, then finding support such as local resources and different types of therapies. Therapies can include those that help you find hobbies to help patients ignore eating habits and or cognitive therapies, as mentality is a huge contributor to eating disorders. And through all this, there's a financial standpoint, but that can be dealt with by discussing issues and reasonable options for situations. There are also occurrences in which medications are prescribed not to fix the eating disorder, but rather the mental detriments, such as going on antidepressants. Eating disorders are very serious and more common than we want to accept, but there is support and help out there. Thank you for listening, and again, there is support and help. Please visit the site or reach out to someone to learn how to help your loved ones fight these disorders.